Autopsy doctors of Reddit, what was the biggest revelation you had to a person's death after you carried out the procedure? Worked at an animal hospital. They did necropsies for zoos all the time. An alligator died, and they shipped it to the hospital, refrigerated etc to stop the decay. They took it out and put it up on the table. After doing all the paperwork, they started opening up the alligator. After the first cut, the alligator opened its eyes. Turns out it wasn't dead. The zoo vet mistook an illness for death and the low temperature put it basically into a coma. Unfortunately, this is all the information I know on this story. It's been 7 years since I worked at that place. This reminds me of a guy in Florida that was picking up dead iguanas. It had gotten so cold they would fall out of the trees dead. Except they weren't dead and sprung back to life as they warmed up in his car. He crashed but was fine. I worked at a coroner's office for a while, and once we had a guy who we thought had died from an OD on M. Well, we started the autopsy and I went to cut his lungs out and blueberry muffin mix started coming out of them. I stuck my finger in his mouth and it was full of blueberry muffin mix. And it was in throat. Turns out he got just high enough to pass out while eating the muffin mix and he ended up choking to death. 6 months after my aunt's passing in a drunk driving incident, the coroner decided to ring up my mum and inform her that they completed their report on her passing and deemed the likelihood of suicidal intentions which may have factored into said incident. I initially didn't understand how coroners could deduce such a thing until I remembered self-harm scars are a thing. My mum had only just gotten to the acceptance stage of grief, and it put her firmly back to square one. She's fine now. I did the autopsy of both the robber and his victim. The robber shot the victim in the back when he tried to escape in a motorcycle, and the robber was shot by the police in the exact same situation. What's interesting is that they both died by exactly the same lesion. Both of them had their fourth lumbar vertebra shattered and their aorta, main artery of the body, sectioned at the same level. I thought of it like an extreme example of instant karma. So I'm not an autopsy doctor or anything of the sort. I did sit in on a murder trial. The mom drowned her infant in hot water. She claimed she was giving her newborn a bath in the sink with one of those sling type inserts so babies can't go under. The doorbell rang. She answered and came back to her kid in scalding hot water. She claimed the kid had somehow turned on the hot water and burned himself while she was answering the door, but drowning was the ultimate rule of death. In the autopsy photos, the most disturbing thing I've ever seen in real life is you could clearly make out hand marks on that poor child's skin. On his biceps, you could see the finger outlines like you do if someone slaps you. I was 18 years old taking a criminal justice class. Just the ease of watching the trail and her nonchalance killed most faith I had in humanity at the time. I know this doesn't quite fit the question, but for years I saw that boy's face in my sleep. What really kills me is despite the evidence she got off. During my internship rotation a couple of years back, a 40-year-old guy came in because he suddenly collapsed while drinking with friends. He came in unresponsive, mouth bleeding, and not breathing, so we had to intubate him. For some reason, the endotracheal tube, the stiff tube placed inside the trachea to help the patient breathe, won't go in, but we managed to suction copious amounts of blood clots. After CPR, still with unsuccessful intubation, so we had to bag him with a face mask, the patient was declared dead and diagnosed with a ruptured abdominal aortic aneurysm. During the autopsy, they found out that the guy was apparently shot by a gun from the top of the head. The entry wound was obscured by his hair and was barely bleeding at all, and the bullet somehow went through the back of the guy's throat and made a hole behind the base of the tongue, which the endotracheal tube kept slipping into. As a student in the medical field, I had the opportunity to visit a cadaver lab. I was very surprised to see how many people had died from choking. Out of the 12 or so cadavers in the lab that day, at least 7 or 8 were from choking. I went home and immediately looked up how to perform self-Heimlich. Training in the medical examiner's office. Elderly woman found dead by herself in her home. There was nothing suspicious, so I was given the case. Took out all the organs. Dissected everything. Completely unremarkable. I cut through the larynx as the last step before I could clean up and finish the case, and boom, giant piece of chicken lodged in her windpipe. Died choking on dinner. I'm single and happy being single, and honestly I think about that scenario too often. Choking on my food, Dying alone in my apartment. My cat eating my face. During medical school I did a forensic pathology rotation during 4th year. Had an autopsy on a woman found in her burned out home. She was on home oxygen and the fire started in her bedroom. There were also liquor bottles around the home, so the thought was maybe she was drunk, smoking in bed, and caught herself on fire. She was badly charred up on the outside with no real distinguishing characteristics I could see. We opened her up and when we got to her lungs they were just the prettiest pink you could imagine, just like in the textbooks. This means she wasn't alive to breathe in the smoke and soot from the fire, so she had died. Spoiler, was murdered before it was set. Ultimately I read in the paper some weeks later it was the boyfriend trying to get insurance money. Former homicide detective here. Suspicious death. 30-ish male found alone by cleaning staff in the back row of a sparsely attended sci-fi movie. Strange scratching wounds around in mouth. Some petechiae in eyes and on cheeks, but no signs of strangulation. No obvious signs of chronic illness or disease. Presented as healthy, normal adult male. Found on his person was a wallet with normal contents and a single cancelled movie ticket, indicating he went alone. Weird, spy movie crap going on here. Autopsy. A large amount of popcorn compacted in his esophagus, like a half cup. Dude was apparently excited by the movie, stuffing popcorn in his mouth, and choked. The scratch marks around in his mouth were self-inflicted. Trying to dig out popcorn, verified via fingernail scrapings. His was only DNA present. Loud movie. He was in the back. No one saw or heard him choke. I've never eaten popcorn again. My worst food choking has been popcorn. That crap is dangerous. I was an investigator for a state medical examiner for just over 2 years. Had a mom that had drank herself to death according to the husband after relapsing on Mother's Day weekend. I just felt like something was off. Sent her for an autopsy. Had a ruptured liver where dude had essentially beat her till she internally bled to death. Later, while out on bail, he stole a semi-truck, crashed it in a pond, got out shooting at a deputy, and they killed him. Saved the taxpayers a good chunk of money. Not a doctor, but a whole body scientific donation technician. I'm the person who dissects cadavers after they were donated. We very commonly would get young cases, normally overdoses. Had a mid-30s female. Went to medical examiner prior to donation, but they only did an external evaluation. I went to check her genitals to see if I could palpate a uterus. Found a condom full of pills. Similar to most, the body became a crime scene and we couldn't touch her. When we finally were able to continue, they asked us to photograph the pills to send to the examiner's office. They were mostly Advil and Zytec. Easily one of the weirdest things I've ever found. My theory is she was gonna start carrying drugs that way, but wanted to practice with something that wouldn't kill her first. Med student almost graduated here. A couple years ago I attended the pathological anatomy course and during a class the professor showed us some autopsies. Despite the tremendous smell of 4/5 consecutive autopsies, one of them was carried out on a homeless patient that died in the year probably due to heart failure. The body had massive ascites, flared in the abdomen, so at first he had to evacuate it. Imagine him cutting the abdomen and the yellow rancid liquid started to come out like a fountain. One of my colleagues fainted. Then the next step was to examine the abdominal organs. Imagine the face of every person in the room when it became clear that the patient had some form of inherited polycystic disease and the liver and the kidneys were full of cysts. The liver weighted more than 10 kilograms, normal weight 2-3 kg, and the kidneys almost 3 kilograms each, normally 150 grams each. The professor was really shocked at the beginning, but then he really enjoyed cutting through the cysts in order to get samples. They popped like airballs, spreading liquid all over the place. Second colleague fainted. The other ones were pretty standard, but I think I will remember forever this one. In particular that liver on the scale. I even took a picture but I can't find it anymore. PS. I'm sorry for any mistakes but I'm not a native English speaker. The professor was really shocked at the beginning, but then he really enjoyed cutting through the cysts in order to get samples. They popped like airballs, spreading liquid all over the place. Second colleague fainted. I'm sorry but this is hilarious. When my parents were in medical school, they attended an autopsy of a patient who had died in a car accident. Autopsy revealed that apparently this guy had survived a chest shot in Vietnam years ago that the surgeon's medics left in rather than perform risky surgery. The accident had migrated the bullet to his heart and was ruled the cause of death. Last casualty of the Vietnam War. Working in the air, young man comes in, 1 of 4 in a nasty auto accident. Speed plus inexperience equals car flipped. Passengers ejected. 1 expired shortly after coming into the air. I transported the body down to the morgue. First time I had felt a human being with all their bones broken. Felt like trying to lift sheets full of rolling bowling balls. Once in the morgue I commented how unscathed he looked. He really did. Some dirt. The ET tube. Not much else. Emmy offered I could view the autopsy if interested. I was interested. The first thing they noted were the rays of the fractures. Basically all the major bones including multiple rib fractures. When they opened the body, the organs were described as near liquefied. It wasn't until weeks later I got the whole story from the EMT who had been on scene. Seems the passenger had been 1/2 in 1/2 out the window while the car had been flipping. He was just days shy of 17. The driver was just days past 16. His parents had bought him a brand new car. He'd had it less than 72 hours. Driver lived, though with severe brain damage. Front and rear passengers died. Rear driver's side passenger survived with not too much permanent physical damage. I have friends whose kids are getting their driver's license. I never pass up a chance to drop that story on them. I've seen a lot of effed up things in my healthcare career. That is one of the grand total of 3 that make me tear up. And it's one from early on. This story circulates every year at my medical school. A body came in with a gunshot wound to the chest. There was no exit wound. They tried to locate the bullet during the autopsy. No success. They then did a whole scan, X-ray or CT of the upper chest, abdomen, pelvis. No bullet at that point. Someone said frick it, let's scan the whole body. Lo and behold, the bullet was detected in the popliteal fossa, area behind the knee. It had embolized, traveled from the heart all the way down the arterial system to the knee where it got stuck in one of the narrower blood vessels. My grandmother had a massive stroke in her 30s that paralyzed her entire left side and died in her 60s from a heart attack. But while doing the autopsy they found out she had bad lung cancer. But she never had any pain from it because it was in her left lung. She was a very heavy smoker, so it made sense. It's just crazy that she had lung cancer and never knew. Lung cancer is usually asymptomatic until late stage, so this scenario isn't as unusual as you might think. Getting chest pain or cough usually only occurs at stage 3 onwards. Stage 1 or 2 typically found incidentally, i.e. if they are being investigated for other things and you see something on a scan. My wife is a pathologist assistant and during her schooling carried out the autopsy of a newborn that died minutes after birth. The mother was desperate for a child and had a history of multiple miscarriages at different terms. This was her first time making it full term and all prenatal checkups revealed no problems. The delivery was difficult, but successful, and baby was alive for a short time. Skip to autopsy. All signs point to baby being fully developed. Get to the abdominal cavity and the liver is lacerated and hemorrhage everywhere. During the difficult delivery the resident used too much force with the forceps to pull the baby out. The ruptured liver that caused the baby to bleed out internally. Wife was enthusiastic about autopsy up to this point. Now has no interest. Oh, that is absolutely horrible. The poor woman. Sheep farmer. I have to know how to do a necropsy for when something dies to know if it's something that could spread. How do you fall over dead after losing a ton of weight and after treating her for everything under the sun? She would gasp for air and struggle to breathe, but antibiotics, steroids and anti-inflammatory drugs didn't touch it. She finally passed away and I cut her open to see what the heck happened, fully expecting to see her lungs riddled with crap. Her heart was 5 times the normal size and hard as a river stone. My guess is she'd had that issue her whole life and it didn't kill her until she was 2. Poor baby. I was in charge of making copies of all evidence to be used in the trial of Donald Harvey in 1989. He was known as the Angel of Death. One bit of evidence was an autopsy photo of an exhumed elderly woman. The examiner was holding with tweezers an 18 inches piece of cotton being pulled from her throat. Harvey liked to stuff cotton so far down into the victim's throat that it could not be seen. I still can't shake the image from my brain. God, that's freaking horrible. Masters in forensic pathology here. You'd be surprised to know the number of people that have life-threatening issues that never went diagnosed and that they didn't die from. Seen an older guy who died of pneumonia in hospital. On autopsy, the guy had both an enlarged heart and a couple of medium-sized aneurysms in the brain. Another guy in his 70s apparently came into the ER and had chest pain, then died shortly after. Dies of a heart attack but also had cancer. In less natural circumstances though. Saw a guy who had been shot in the head a couple of times. 3 definite entries and a blown out skull, but police only found 1 bullet. Couldn't find the other bullet in his head at all. Assumed the police missed it. Went on as normal with the autopsy until we got to the chest cavity. The other bullet was just chilling beside his lung. Turns out it entered the skull, hit the inside, ricocheted down his neck and into the chest. That was pretty wild. It's so wild to me how on the one side, humans can be so resilient and survive horrible things, and on the other side just how fragile and quick life can be taken from us. 2 very different extremes. Thanks for sharing your perspective. In medical school, my group's cadaver was an 80-plus-year-old female who was extremely unfit, morbidly obese with muscles half the size of any other cadavers. Her pectoral muscles were paper thin. To get some reference, we figured she was bedridden during her last few months, which would somewhat explain these findings. When we started our neurology unit and began to dissect the infratemporal fossa, I discovered a small metal pellet under the skin behind her right ear. My tank mates and I went on to find dozens of these metal pellets strewn around her head's anatomy, with some lodged into the cranium and others in the bones of her face. We contacted her living relatives to get some clarification, and they ended up revealing that when this lady and her brother were children, they said she was 8 years old. They were playing with an old decorative rifle that the family had mounted above the fireplace. Long story short, the brother accidentally discharged the rifle into the girl's face. The aftermath was this lady was blind and wheelchair bound for the rest of her life, and the pellets weren't all removed. It was an interesting dissection with that information from then on, but a sobering moment in reminding our class that our cadavers are humans with their own struggles and rich lives. If you're considering donating your body to science, please know that we don't take the responsibility lightly, and a million thanks aren't enough. I have more stories if anyone is curious. I should add that her granddaughter made a point of saying this lady did not hold a grudge on her brother, and they lived full lives on happy terms. My old martial art instructor was a policeman in the 80s. He was shot with birdshot in his torso and many of the pellets were not removed. He said that sometimes they make their way to the surface and he can just scratch them out. Not mine, but a doctor I used to work with. Back when he was in school, he would do his cadaver labs really late at night. To many people during the day. One time it was really late, around 2 AM. He was listening to his lecture on his headphones and he saw the cadaver's arm move twitch. He thought it was just his mind playing tricks on him. Then he saw it again, proceeded to run away in a panic. He told a few of his classmates what happened, but nobody believed him. Next day they had a group cadaver lab with the same cadaver. The arm twitched yet again. The professor did some digging and it turns out the patient's pacemaker was still fully functional and occasionally fired, causing the arm twitch. He was so relieved. He thought there was a zombie in there. The professor did some digging. Literally. My dad used to perform autopsies. His best story was that they were brought a body that has no real indication of any issues. After examining the body, the only thing of note was that there was blood coming out of the guy's rectum. They begin the autopsy and the guy's organs are completely liquefied and the body cavity is filled with lead shot. It became apparent really quickly that someone had shoved a shotgun up his butt and pulled the trigger. This was in the 70s and I still have to wonder what this guy did to pee someone off enough to get a shotgun up his butt. Not exactly an autopsy per se, but it was a patient found unresponsive, with CPR in progress by EMS. The man was clearly homeless, based on his appearance and smell. He reportedly had not been seen for several days by his friends, and was eventually found behind a fast food restaurant dumpster. We were briefly able to get a pulse back, and when the nurse cut his pants off to place a catheter we saw the cause. He had fashioned some sort of makeshift cock ring out of the neck of a plastic bottle. It was way too tight and completely cut off the circulation. The dong was fully black and necrotic. I did a bedside ultrasound and found his abdomen full of free fluid, which is bad. Most likely his bladder had ruptured from being unable to urinate for days. His labs suggested he was in septic shock and full-blown renal failure as well. He did not survive much longer than that. I remembered another one. In my final year of training we had a cadaver lab to practice advanced airway management techniques. For example, difficult intubation, cricothyroidotomy, etc. While I was helping an intern do a basic intubation, she commented the tube wouldn't pass. I think she has some kind of growth or mass in her airway. I took a look, asked for some forceps, and pulled a half-eaten hot dog out of her larynx. It of course had been embalmed along with the rest of her. Cause of death identified. Oh god, this one is terrible. Poor guy, that must have been excruciating. Medical examiner here. This probably isn't a big wow revelation, but it certainly made an impact on me. Very early in my career, I did an exam on another doctor who worked at the hospital where I trained. I didn't know this gentleman personally but was acquainted with him by reputation. He was a very happy-go-lucky sort, much loved by everyone in his department. He died unexpectedly at a young age of what turned out to be a drug overdose on pharmaceuticals he had been diverting from the hospital. I don't think anybody saw that coming, myself included. It was a lesson to me that anybody can fall victim to addiction, and that it's hard to know what anybody's private struggles are. Medical student here, and this story is from anatomy class. One of the cadavers in our class died of cancer, and when we took out the gentleman's liver it was very large and full of bumps all over. The liver itself was also hard as a rock. The poor man's cancer had spread all over his liver and was full of tumors. It really hit home that this was what cancer was like and demonstrated its pure destructive nature. We have a man's liver in a pot at my uni and it is rather large, but more importantly it looks Dalmatian spotted with metastatic melanoma. After that class I immediately made an appointment for that afternoon to organize a biopsy on what turned out to be one on my arm. I am not a pathologist, but when my father died from drowning, it was noted he had acute cirrhosis of the liver. The coroner also removed a bullet from between his heart and spine that Dad received in Vietnam. It was very degraded. He had also lost a thumb and several feet of intestine there, the evidence of which was noted in the report. Dad had served 22 years in the army, and he had been awarded the Purple Heart 3 times. He lived a hard life after, and it was speculated he would have passed soon of cirrhosis of the liver had he not drowned. My friend had to do an autopsy on a baby. The dad claimed she died after rolling off a couch. My friend found that the kid was slammed against a hard surface multiple times. Dad eventually admitted he hit the baby against the wall after she wouldn't stop crying. My friend had to quit that job cause it was so taxing mentally. Dad eventually admitted he hit the baby against the wall after she wouldn't stop crying. The sad part about this is that babies sometimes just cry. There is nothing wrong with them. They are tired and just can't sleep. Not a doctor, but I did a necropsy on one of my birds a couple weeks ago. I couldn't tell how she died before it happened, but after opening her up I found about 14 masses of tissue in her reproductive system. At first I thought it was cancer from dissecting one of the masses. Later I found out it was actually an intestinal infection. It was actually a reproductive tract infection. Some of y'all were asking about the vulture that lives in my backyard named Randy, so I made Aranda the vulture. I had to do one on one of my birds the other day too. She had a mass of fluid the size of a closed fist inside her. 150 grams of fluid weight. It was pushing everything inside to the outside, and we never even saw that coming. Cystic oviduct. I'm sorry about your bird. I'm a med student, not a pathologist or coroner. But in anatomy lab the tank next to me had a donor with an inflatable dong pump inside his scrotum and shaft. It was completely self-contained. Fluid in the container in the scrotum could be pumped into the shaft tube, creating an erection. Then the fluid would just be released back into the pump and the boner would go away. Pretty wild. I'm a medical student, not a doctor, but when I dissected my cadaver in my first year, It had lots of surgical markings and was pretty overweight. After I'd been able to work through all the parts of the body with my group, we were able to piece together with our lab leader that our donor had been in and out of the hospital for a quadruple bypass, followed by a pacemaker, a stomach stapling, and then what looked like an emergency open heart surgery that she died during. Not a rare disease or strange occurrence per se, but it was interesting finding clues around the body as we learned anatomy. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.